Growing anxiety this morning about the COVID-19 trend in Canada as we take a look at the numbers. The big number is 5,713 new cases just yesterday. That's a new single-day record. The number of cases per capita also cause for concern. As we take a look at the map, this reflects the rate of infections. And as you can see, much of Canada, well over 100 cases per every 100,000 people. The West, that's where the rate is highest. It's the deepest shade. Manitoba, the highest per capita infection rate. But infection rates have also reached record levels in all three territories. So these are concerning directions. And let's talk about them with Dr. Isaac Bogoch, who's an infectious disease specialist at Toronto General Hospital. He joins us every Tuesday at this time, and really happy to have you back with us. Thanks, Dr. Bogoch.
My pleasure. Great to see you.
Maybe we can bring back that big number again just to sort of rest our eyes on that and absorb it. 5,713 cases in one day, the highest number yet. Dr. Bogoch, what worries you most about the national picture?
Well, a couple of things. One is the direction that we're headed in, and we certainly still see this number rising in many places, and we haven't yet seen either sound policy to get this under control, or even when policy has been basically applied, there hasn't been enough time to actually watch the numbers plateau in many, not all, but in many parts of the country. So that's one. And the second thing is that's a large number of cases to absorb. That is very, very challenging to absorb. That's also going to translate into a significant number of hospitalizations, sadly deaths, and that's tough for healthcare systems to absorb in an effective manner. We've got to clearly get that number lower.
We are seeing, in response to the high numbers, provinces taking tough measures. Ontario in a lockdown in Toronto and Peel region. Alberta, we expect today, Dr. Bogoch, to see some form of new restriction. And I want to talk to you about Alberta for a second. Dr. Hinshaw, the top doctor in the province, said Alberta is in a precarious position. And something that she was talking about yesterday caught my attention. This is the contact tracing part. How tracers are overwhelmed. They can't keep up. There's a big backlog of cases, so people don't even get calls. They're getting text messages now. And this is not just obviously Alberta's problem, but I'm wondering, how do we find out sources of infection? How do we find out problem areas if you have to essentially abandon the system? What are the consequences of incomplete contact tracing?
Yep, it's terrible. It's absolutely terrible. You're fighting blind. When you don't have the data, you have no clue what direction you're headed and how to pivot or point and where to point your public health measures. It's very, very challenging. You need good surveillance data, good contact tracing data, good diagnostic tests to really help inform and steer the public health response. When you're not getting that information coming in, you're fighting blind.
So what is the solution? How do you get it then?
You've got to, unfortunately, when case levels get so high, you have to take drastic measures to get them under control. And that's what we're seeing now in for example, Peel, Toronto, and much of Quebec as well, in parts of Manitoba, where you have pretty significant public health measures, all of which are really aiming to reduce the number of contacts of individuals, which will hopefully translate into a slowing down and even a reduction of new cases per day. Once you sort of get that under control, while you're taking those public health measures, governments and public health units should be working frantically to boost their diagnostic capacity, their contact tracing capacity, their abilities to safely isolate people that don't have a place to safely isolate, and to really take a step back and look at what are the drivers of infection in our community and how can we address these? Because ultimately, those public health measures are going to be lifted. And if you're not dealing with the upstream issues of how you got there in the first place, or the issues of how you're going to manage them, I mean, you have to ask yourself what you're doing all along. So it's one thing to impose these significant public health measures. It's another thing to address where these cases are coming from and increase the capacity to manage the cases that you're going to continue to have moving forward.
During this particular time of lockdown, to make sure that the pain really does lead to something significant at the end of it all. Since you've mentioned lockdown, Toronto, Peel region, this is part of our reporting today, Dr. Bogoch. We're hearing from a lot of small business owners who are very upset. They're very frustrated that in the province or in those regions, big box stores, which are selling essential items like groceries, they're allowed to keep open and keep selling non-essential things because it's logistically challenging not to have both for sale. And then they have these small mom and pop operations shut down, not allowed to be in business. And they're really concerned about their future. I'm just wondering, from a public health perspective, what do you make of their complaints and their concerns?
I certainly would share their frustrations. That's an extremely challenging situation to be in. And we know that if you poke around and go into many small businesses, you can see how people have bent over backwards to create a very safe experience for customers and for employees. So when you have these blunt policies that are sort of these all-encompassing heavy policies, they don't have the nuance in them to protect everybody underneath that policy, and it's clear that small businesses are going to be severely impacted by this. And if we have to take a step back and think about just from a pure medical and scientific standpoint, we know how to create a safe indoor space. We know about ventilation. We know about physical distancing. We know about mask wearing. And it's pretty straightforward in many, not all, but in many places to integrate that. Even the ventilation component, you can do something as simple as keeping the door open. And people say, well, it's winter in Canada. Okay, crank the heat up. So there's a lot of creative ways that we've seen people essentially adhere to those fundamental public health principles in their small businesses and do it well and create safe indoor spaces. So when you have policies like this, I can see that their frustration. It can be extremely challenging.
A lot of COVID headlines in our news today. So we're having a wide-ranging conversation because I always like your perspective on all of these stories. I can't let you go without talking about the latest vaccine news because, of course, yesterday with the Oxford University AstraZeneca announcement that they think up to 90% effective. So that's given a lot of cause for optimism. And I want to talk to you about that because I was doing some reading in the Montreal Gazette, really interesting piece, Dr. Bogoch, quoting health experts, urging us to be more suspicious, more skeptical before we rejoice, that we don't even really understand what 90% effective means, that none of this is independent data, it's not available yet. Can you perhaps, I guess, not temper things, but help us help us even understand what effectiveness means from a scientific perspective and really how we should be absorbing and approaching what we're getting news-wise on vaccines.
Right. So I think I love the points that you raised, and I agree completely. There is this issue about science by press release, and we're only given snippets of information. We haven't seen all the data. We don't know exactly what happened. We know how this trial was conducted, and we know some limited bits of data that were released in the press release. Those limited bits of data were very promising, but like anything else, show us the data. And this is going to be something where the medical and the scientific community and the lay community will be poring over to really determine, what exactly did they do? How good are these results? And I think that's an extremely important point. And I'm sure that's going to happen at some point, but it just hasn't happened yet. The second point that you raise is also very important as well, because oftentimes things aren't as rosy as they appear in a clinical trial when they're actually rolled out in a population. So are we going to see anything from like 70 to 90% efficacy when this is rolled out in real world settings among millions and millions and millions of people? I don't know. I honestly have no idea. But even if it's anywhere near that, it would be a huge success. It's just probably not going to be exactly as advertised for about a million reasons. But it's just I think it's important for us to realize that what happens in the real world is sometimes quite different than what happens in a very controlled clinical trial.
Okay, keeping that in mind. But something that was just that was clarified for me in reading was when you say it has a 95% effectiveness, that doesn't mean it protects 95% of recipients. It means that people who get it have a 95% lower chance of contracting the disease than someone who doesn't. I mean, that's an important distinction, isn't it?
Right. That's a great point. So, for example, in all these studies, let's just, for example, say that there was 100 people that had the infection. They would say that, well, of all those 100 people that had the infection, in 10,000 people enrolled, I'm making up numbers here, but in 10,000 people enrolled, 100 people got the infection. They would say that of those 100 people, 95 of them were in the placebo group, and they got the infection, whereas 5 of them got the actual vaccine. So that's how they're arriving at the numbers that they are reporting.
Okay.
Which are good numbers.
They are good numbers. But again, as everyone says, the light at the end of the tunnel, which is great. But again, to keep in mind as we go through
Yeah.
these months of learning more about vaccines and how they're going to work for us. Dr. Bogoch, as always, thanks for this Tuesday.
My pleasure. Have a great day.